Thank you for the invitation. There's a lot to be said about communication in health in general and rare diseases in particular. For those of you who have already reviewed the e-learning module attached to this session, I was deliberately aiming not to go over some of the material that's in there, but to sort of take a sort of side-by-side perspective about communication. This is really a recapitulation of many things that we already know, and that's for individuals and families coping with a rare disease, that there is uncertainties and worries about the future for pretty much everybody, that there can be concerns and worries about the reactions of family members, friends, as well as strangers, people who might ask questions and comment, and also wonder about how to talk about a diagnosis with an affected child as well as other people, how to explain a rare diagnosis, particularly when it's been struggling to understand it yourself, and how to have contact with other individuals and parents and others affected with or families living with the same condition. And there are resources that we know are common to many different conditions, but there are aspects of a rare diagnosis where this really sets apart what can be effective for families and individuals. So in terms of some of the general principles of communication, I'm not going to go over those in detail, because I think as healthcare providers, we should be very sensitive and aware that we need to be very much in touch with what the experience for that individual and family is in terms of the way that we explain information, what their journey has been to that point in reaching a diagnosis, and how we actually disclose the diagnosis. So I'm not going to review that in much detail. However, what more can we do is what I find particularly interesting. And I think that we can do a lot more as far as introducing our clinical role as facilitating a mutual journey of learning about the condition, because most of the time there are no medical specialists who know a lot about a particular rare condition. So we are learning alongside our patients and families a lot of the time. And we want to emphasize that this is a journey we're sharing with them, including the process of individualized problem solving and decision making. So where is somebody at on a particular day? And we might be able to find some references in the literature. Maybe we can't. So we need to be able to make decisions about what is a person presenting with on a particular day, and particularly with parents asking them what's normal for their child, because we may not have anything else to base that on. And in the e-learning module, they talked about the importance of language. There was a reference to the importance of translation into other languages. And I think for me, I'd like to emphasize the choice of language, full stop. So the use of neutral, very much grounded in everyday language, and I guess very much individualized to a person's culture as well as their family situation. And so, I think we can talk about in genetics, we're used to using analogies and trying to simplify how to explain the underlying basis of a genetic condition, full stop. But I think we also need to try and be inclusive when we're talking about a rare diagnosis, that although this is rare, there are many common elements with other conditions, and we can choose our language, I guess, with more care than we might normally. I would go into more detail if we had more time, but there's many examples that I have where I think that there's specific terms and choices of analogies that we can use. Another thing that I think is really important is that we could consider specific tailored tools and resources to address some of the practical aspects of daily life. And this is really just to help people organise what their records are. And sometimes if you've got a rare diagnosis where there's very little known about the natural history, it can be a very practical thing to keep track of signs and symptoms, when they occur, how they occur, and in addition to obviously medical documentation. And so I've just put an example there of a customisable care notebook. There's many versions online that you can fill in the templates to help you with keeping accurate records. And I think that can be a really helpful organisational tool for people with rare conditions. And I've just put in there an example of a resource produced by Global Genes, which has a lovely booklet which helps people to talk about a genetic condition with family. So one of the things that really is a common experience for people with both rare and undiagnosed conditions is this feeling of ongoing uncertainty. And even if people do get a diagnosis, it might not actually solve anything as far as, what the prognosis might be, what the treatment or management, if there is any available, what that might be on a day-to-day basis. And I think there's a lot that we can do to help facilitate a sense of control, even with this uncertainty. And I think we can be actively encouraging as healthcare professionals. I think we can emphasise the authority and competence of care of self or child, and the clear value of advocating for yourself or your child, and that this is valued in the healthcare system, and that we value people's experiences and opinions. I think we can also mutually assess the controllability of specific stresses, and some of these are just so common. We'd all be very familiar with them, and access to therapies and funding is a huge issue when you have a condition nobody's ever heard of and don't tick any boxes. So we can have a look at, what are some of the terms and specific language that we need to use to help access services if that's something that people identify as a major stressor. We can also guide people to high quality resources to facilitate connections with others. And there's many, many out there. And I think one of the problems is that there's too much out there. So people often don't know where to start. So these are just a couple of examples there, with Eurordis and Nord being two good examples of places to start. Just a little journey diagram to actually look at promoting the mutual support between health providers and families. I think it helps to just map it a little bit, what that actually looks like. And it starts by building those partnerships, as I was talking about before. And it is an open-ended process, and we need to talk to people. And in the e-learning module, this is clearly outlined about being transparent and open about the lack of knowledge, whether it's personal to the managing teams or in terms of the wider healthcare system. And we need to be clear that there is really, the situation usually is a possibility rather than a likelihood of definitive management and treatment options. We need to look at balancing expectations. What are families hoping for? Of course, they're hoping for a cure and a treatment. We need to share that with them, that there is we need to think about the fact that there is this uncertainty, and that we have to make room for that, and that it's part and parcel of having a rare condition. We also need to provide structured support with understanding of the information that is available, adjustment to that particular condition, what the known implications might be, and decision making, which might be perhaps planning future pregnancies. And of course, I'm going to say and put a plug in to consider a referral for genetic counselling, please. Okay. And when I say normalise experiences of uncertainty, I think that COVID has done wonders for people to realise that the world is uncertain and that everybody has experienced uncertainty. This was not always the case, but I think we can emphasise even that there's a variable prognosis with common conditions. And I often refer to Down syndrome. If we took a room full of Down syndrome, people affected with Down syndrome, there will be varying levels of complications, varying levels of functioning. And I think most people, I guess, can relate to that there is that variability with common conditions as well. And I think that the continuity of care is something that really helps to promote that mutual support, that we emphasise and reassure that care will continue regardless of the uncertainty, that we'll keep listening, keep learning, and we'll keep doing the best we can to manage signs and symptoms, and also that we will keep looking and searching for information if and when that's available. And the collective commitment of ongoing follow-up is also really important. I find that a lot of families, if they get a diagnosis, that they're not quite sure what happens next. They are told that there'll be referrals to a number of different specialty services, but they're not quite sure when that's going to happen and what that will look like. So I do think it's important to have somebody that they trust and know, who they can go back to and keep in contact with. And hopefully with all these things, we're looking at a process of maintaining those partnerships with the family on an ongoing basis.